Understanding postpartum depression, a guide for new moms. Bringing a new baby into the world is an exciting and life-changing experience. While many mothers feel joy and love when their baby is born, some also experience a range of difficult emotions they weren't expecting. Postpartum depression, PPD, is a form of depression that can affect women after childbirth, and it's more common than many think. What is postpartum depression? Postpartum depression is different from the baby blues, which most mothers experience shortly after birth. The baby blues typically last a few days or up to 2 weeks, with feelings of sadness, anxiety, or being overwhelmed. These feelings usually go away on their own as hormone levels stabilize and the mother adjusts to her new role. Postpartum depression, however, is more intense and lasts longer. It can start soon after childbirth or even weeks later. Unlike the baby blues, PPD doesn't just go away on its own and may require treatment. It's important to understand that postpartum depression is not a sign of weakness or a reflection of how much you love your baby. It's a medical condition that can be treated. Symptoms of postpartum depression. The symptoms of postpartum depression vary, but some of the most common include intense sadness or mood swings, feeling deeply sad, crying a lot, or having extreme emotional highs and lows. Loss of interest, not feeling excited or interested in things you once enjoyed, including bonding with your baby. Fatigue or exhaustion, feeling too tired to function, even after resting. Sleeping issues, struggling to sleep, even when the baby is asleep, or sleeping too much. Changes in appetite, eating too little or overeating. Feelings of guilt or worthlessness, thinking you're a bad mother or that you're not doing enough. Anxiety and panic attacks, feeling overwhelmed or constantly worried about your baby's safety. Difficulty concentrating, trouble making decisions or focusing on tasks. Thoughts of self-harm or harming the baby. In severe cases, mothers might have scary thoughts about hurting themselves or their baby, even though they don't want to. If you're feeling any of these symptoms, it's important to reach out for help. Postpartum depression can affect your ability to care for yourself and your baby, but with support, it's possible to recover. What causes postpartum depression? There isn't one single cause of postpartum depression. It's likely a combination of several factors, including hormonal changes. After giving birth, a woman's hormone levels drop rapidly. This sudden change can affect mood and trigger depression, similar to what some women experience with premenstrual syndrome, PMS, but much more intense. Physical exhaustion. Childbirth is physically demanding, and the recovery period can leave a mother feeling drained. Lack of sleep and the constant care required for a newborn can make it even harder. Emotional stress. Adjusting to motherhood can be overwhelming, especially if you're a first-time mom. Many women feel pressure to be the perfect mother, which can add to the emotional stress. Changes in relationships, especially with your partner, can also contribute. History of depression. Women who have experienced depression before, either during pregnancy or at other times in their life, are at a higher risk for developing postpartum depression. Other life factors, financial stress, lack of support, or difficult life events can make it harder for a new mother to cope with the demands of caring for a baby. Seeking help for postpartum depression. The most important thing to remember is that postpartum depression is treatable. If you think you might have postpartum depression, don't wait to seek help. Talk to your doctor, midwife, or a mental health professional. They can help diagnose your symptoms and work with you to find the best treatment. Treatment options include therapy. Talking to a therapist or counselor can help you process your feelings and develop coping strategies. Cognitive behavioral therapy, CBT, is one type of therapy that is effective for treating depression. Medication. Some women benefit from antidepressants, which can help balance the chemicals in the brain that affect mood. Your doctor will work with you to find a medication that is safe, especially if you're breastfeeding. Support groups. Connecting with other mothers who are going through similar experiences can be incredibly helpful. Knowing you're not alone and sharing your story with others can relieve some of the emotional burden. Taking care of yourself while seeking professional help is important. There are also small things you can do to take care of yourself during this time. Ask for help from your partner, family, or friends when you need it. Don't feel like you have to do everything on your own. Rest when you can, and try to find moments to relax, even if it's just for a few minutes. Remember, your well-being is just as important as your baby's. Taking care of yourself is part of taking care of your baby. Postpartum depression is not your fault, and you don't have to face it alone. Final thoughts: if you're a new mother struggling with postpartum depression, remember that help is available, and things can get better. The early weeks and months with a new baby can be challenging, but with the right support and treatment, you can find joy in motherhood again. Don't hesitate to reach out for help. You deserve it, and your baby needs you to be healthy and happy.